Alrighty, so we'll go ahead and get started. If anyone else joins in, then they'll just start when wherever we're at. We are recording this session, so if there's anything that you want to come back and reference, we will be posting the video when it's ready, probably next week sometime, to the Pre-Health Advising website and also to the Cal Poly Open House website as well. So you'll be able to find it in a couple of places. So like I said before, my name is Megan Ferrier-Nolan. I coordinate the Pre-Health Advising at Cal Poly. And so today we'll talk a little bit about what health professions advising is and some of our services, and we'll answer some questions. And we'll also go over some myths and common misconceptions about what being a pre-health student means. On the call today, I have a couple other advisors joining us. So in our office, we have 5 full-time advisors. Their names are listed on the slides, and 2 of them are here with us, kind of working behind the scenes. Anya and Laura will be answering your questions. If you type them into the Q&A box, you'll be able to get a response from them. We also have our peer advisors who are going to be presenting a lot today, and I'm going to go ahead and have them unmute themselves and introduce themselves.
Okay. Hi everyone, my name's Jacqueline and I'm in my 3rd year and I'm a bio major, and my career plan right now is optometry.
Hi everybody, my name is Julie Zwing. I'm a 4th year biochemistry major and I'm interested in pursuing nursing after my time at Cal Poly.
And hi everyone, my name is Connor Hatfield. I'm a 4th year liberal arts and engineering studies major, and I'm pre-med.
All right, thanks you guys. So like I said, the peer advisors will be helping us out with the presentation today. What I want to start with is just addressing the elephant in the room, this COVID-19 pandemic, and why we're doing our session virtually today. And I mean, I know you all are aware that we're doing it to practice social distancing, but this pandemic situation also has a huge impact on both education and healthcare. Those are 2 of the biggest industries that I think are impacted by this situation. There's a lot of unknowns about how higher education will look in the coming years, whether that will be in person or virtual and when. We don't have answers to those questions yet about what is going to happen at Cal Poly in the fall. So I'm sorry to say that we won't be able to answer any specifics on that today. We also know that there's a lot of unknowns with how admissions to health professions programs might change as a result of this. So there's some things out there so far, but there's not necessarily a lot of consensus yet. So again, we don't necessarily have any certainty in that area yet, along with pretty much everything as a result of this pandemic. There's so much uncertainty, and so we will do our best to answer your questions with that. But just know that there's a lot of unknowns at this time. That also means that it has the potential to be a really exciting time in healthcare and an exciting time for you to join the field. There's definitely going to be a huge increase of need of providers. We've already seen that nationwide, and so that is very unlikely to change once we get through this whole pandemic. So I just wanted to start us off by addressing some of those questions that are probably very much on a lot of your minds right now. And so you're welcome to ask those questions, but just know that we might not necessarily have all the answers yet. And we will inform you as soon as we do know answers about these things. So to then move forward, just about pre-health advising in general. So pre-health advising is essentially advisors who help you plan for a future career in healthcare. We will work with you on choosing a career that's the right fit. We will help you with identifying courses. We will help you with how to plan those courses. We will help you with finding extracurricular activities, both in the clinical realm or research or community service and leadership. And And then we also just provide a lot of resources both in the Cal Poly community and in San Luis Obispo communities. So that's essentially what pre-health advising is. What I always like to also talk about with our prospective students is to really emphasize the importance of finding a pre-health advisor or a health professions advisor at whatever campus you end up at. I know that you are probably on this call today because you are interested in Cal Poly, but you might also be interested in other campuses. And so wherever you end up, make sure that you have a pre-health advisor. We offer a lot of support to students. It's a very intense process, and so having that support is super important. And so wherever you end up, please find that office. It might be a standalone office. It might be in the Career Services Center. It might be in a General Advising Center. It might be in an academic college, or it might be in a very specific academic department. It might be a staff of peer advisors. It might be a staff of full-time advisors like myself, or it might be a faculty member in a department. So sometimes it can be kind of hard to find because the place, the home for the pre-health advising can be different depending on what campus you're at. So I just encourage you to find that resource wherever you end up, and hopefully you can find it in all of the campuses' open house activities that they have for prospective students, just so that you have an opportunity to connect with the advisors and see what the structure is before you start at that campus. And if you are struggling to find that, I recommend just asking an advisor or a career counselor or a faculty member in the sciences, and they will likely be able to help you find who where that advising center is. So at Cal Poly, we advise on many health professions. These are the ones that are most common. There are four-year doctoral degrees, there are other graduate degrees, and there are and then there's some clinical training that we advise on. The ones that are definitely most common among Cal Poly students are medicine, dentistry, physical therapy, occupational therapy, physician assistant, and nursing, and genetic counseling is definitely becoming much more popular among our students. I will say that Cal Poly does not have a nursing program. And so if you are considering nursing as a career, then you might want to consider an undergraduate college that actually has a bachelor's degree in nursing. That said, we do talk to many students who change their plans during the course of their 4 years at Cal Poly, and sometimes they'll come in being interested in physical therapy, learn about physical therapy, and they find an interest in nursing. And so we can still support students in going on to a career in nursing after they graduate from Cal Poly. There is still the possibility to become a nurse after you graduate from a school that doesn't have a nursing degree. I'm going to stop myself for 1 second because I'm not sure if I mentioned this or not, but for the Q&A and the chat, if you type anything into the chat, we won't respond to any questions in the chat, so do type any questions into the Q&A. And the advisors will get back to you. Okay. So at Cal Poly, what we offer for our health professions advising services, namely our biggest chunk of time that we spend with students is one-on-one. And that's either with one of the 3 peer advisors, and that staff changes every year because they're students themselves and graduate, of course. And also our staff advisors. Our peer advisors see students in their 1st and 2nd years. Or any time before they get to the point of applying. So sometimes they might see students in their 3rd or 4th years, depending on when a student has decided that they want to apply to a program or pursue a profession. And everyone's timeline is very individualized, and so we work with students in that one-on-one capacity to help you determine your own individualized timeline. Our website has a ton of information. I highly encourage you to check it out. It's pretty simple, prehealth.calpoly.edu. Hopefully you've already looked at that a little bit. That website has a lot of information about how we advise students and information that we offer to students in our one-on-one advising sessions. So you can get some web-based advising beforehand. We have a section on experiences that can give you a sense of what sorts of experiences students do both on campus at Cal Poly or in the San Luis Obispo community. And we also have a section that's on applying that's really more geared for students when they're at the stage of applying to graduate programs. We also have an internal website for continuing Cal Poly students that you wouldn't have access to yet, but you will when you become a Cal Poly student. And that is really just a place where we have some more internal resources that we don't want to get the public to have access to. We offer workshops. Some of those workshops are listed on our website. So if you go to our website, you can check out what types of workshops we offer on a regular basis. We also have on our website all of the different careers that we advise on and what we call career profiles for each of those careers with the specifics of what you might want to focus on for each of those careers. On our website, there's also a link to our blog. That's where we will share a lot of information about what is going on campus and in the San Luis Obispo community that you can get involved in. Right now, we have a post that's highlighted about how the pandemic is affecting Cal Poly students and pre-health students in particular. We have a residence hall in our newest residence hall, Yaqui Tutu, that is specifically for pre-health students. And so as long as fall quarter ends up happening in person, then that is an opportunity of a place for you to reside, or whenever Cal Poly returns to in-person, whether that's fall or winter or whenever it happens. Hopefully sooner than later, we are all wanting to go back to campus. We also have some courses that are specific to helping you explore and gain experience in health professions. The one that I'm going to mostly talk about is that first one, SCM 101, which is Introduction to Health Careers. In that class, we bring in providers from the community to basically share what a job and the day in the life is like in that profession. It's a great way to explore a lot of different careers, which we'll be talking a little bit about today, and without having to make a really big commitment to that exploration. The health profession shadowing is more of that commitment, and where you are actually placed one-on-one with a provider in the San Luis Obispo community. Unfortunately, we had to cancel that class this quarter due to the current situation, and so as long as we are able to get back to the point of being able to be socially close, we'll be able to continue teaching that class. Our service learning class is a class that allows students to do some community service with some pretty intense in-class discussion and reflection on those experiences. We have an internship with our public health department, definitely super relevant right now since pandemics and public health departments go hand in hand. And then we also have a class that is preparing you for your application, and so that's offered to 3rd and 4th year students. We offer support for the application process, and a lot of our time is spent in the application process supporting students with their personal statements. We offer practice interviews for all professions once a student has an interview offer. And then we also have student clubs and organizations, basically one for every career at Cal Poly. And we'll talk a little bit more about that later. So now I'm going to turn it over to the peer advisors, and they are going to address some of the myths that we often talk about with students.
Yeah, so one of the most common myths that we see in our office is that students think they have to be a science major, so biology, biochemistry, chemistry, or anything like that to go into a health profession. And that's not true at all. As somebody who's not a science major myself, I can tell you there are a lot of benefits to coming from outside the College of Science and Math. You have a lot of different perspectives on problems and issues that come up, and pretty much any major you choose will have some tie back to healthcare if it's something you're passionate about. So say you want to go into medicine, but you also love political science. You can do both. You can take political science, and as long as you complete the prerequisite courses alongside your major coursework, you're eligible to apply. And that goes for any major, so it really doesn't matter what you choose, as long as it's something that is exciting for you and that you enjoy. You're going to be spending a lot of time taking classes related to your major, obviously, so you want to make sure that you're enjoying your time doing that. And like I said, you can really tie anything back to medicine. So like I said, if you major in political science, you'll have a unique perspective on how structural and political policy influences health outcomes. If you're a Spanish major and you're pre-med, you will have a background in being able to communicate with Spanish speakers in California, which is especially important. And it's important to keep in mind that if for some reason you decide that you don't want to go into healthcare, you want your major to be something that you can see yourself going into a different career with. So if you pick biology just because you think that it's going to be the best major for medical school, but you don't necessarily enjoy biology, that can leave you in a tough spot if you decide not to go into medicine or nursing or whatever health profession you're interested in. And so we encourage you just to pick something you're passionate about, and we can always find a way to fit those pre-req classes in alongside your major.
Okay, and myth number 2 is that it's not possible to study abroad. This is something that I honestly hear all the time from my classmates, and I know so many people who are pre-health and that have gone abroad and been able to do it successfully. The best thing to do here is just to plan early. If you know this is something that you're interested in, just start thinking about it and start meeting with people as soon as you get to Cal Poly. A really good resource that we have is our study abroad office. You can go meet with them, and they have plenty of peer advisors and professional advisors that will help you find the right program for you, find the right time, and figure out which classes you're going to be taking there, because a lot of people have all their prerequisite classes in these labs that they think that they can't take abroad. So you have to plan out which ones you're going to save for abroad and which ones you're going to take during your time at Cal Poly. And another thing to add to this is that you don't necessarily have to do a study abroad program, because there's tons of health related programs abroad that aren't necessarily taking classes. So things like shadowing healthcare professionals in a different country or doing these service learning opportunities are super common and good ways to get involved. So those are the key things to know there.
Okay, so our third myth for today is that admissions committees are only looking for high GPA and test scores. And this is definitely not true. This is something that we really want to emphasize. From the time that you start at Cal Poly, you really want to be building a well-rounded application. And so focusing, on your GPA and test scores because they are important, but there's also a lot of other things that go into preparing yourself for these schools. One thing that this myth can kind of translate into is if I get a C in my first year, I'm doomed. And we really want to reassure you guys that this isn't true. College is very overwhelming when you first get here. The quarter system is really fast paced. And so it can be an adjustment, and it's just important to have patience with yourself. And one thing that's really great about graduate school is that they do account for upward trends in your grades. And so the important part is if you do get a grade you're not happy with, you reflect back on why that might have happened and then move forward. And we have a lot of resources to help you on campus. We have academic coaches that help with study habits, and you can always come see us to kind of develop strategies for that. And so to kind of rephrase this myth, the truth is that your high GPA and test score will get you noticed by a professional school, but it's everything else in your application that will get you into a professional school. So we'll be kind of talking about what it looks like to be a well-rounded applicant. But yeah, the truth is that you kind of do want to put your efforts to a variety of different things at Cal Poly, and it's okay if you don't get it right the first time.
Yeah, and so myth number 4 is kind of the flip side of what Julie just talked about. While experiences are important, and like she said, they are the things that get you into the health professional school eventually. There's no getting around having a competitive GPA and competitive test scores. Unfortunately, that's what a lot of schools will use to make their preliminary cutoffs when they're assessing applications. So a school may get thousands of applications every year, and there's just no way for them to look through every single one. So they may decide, for this particular year, we're not going to look at anything with a GPA of 3.5 or lower, or a test score of, say, like an MCAT of 510 or lower. And immediately all those are not considered. And so it really doesn't matter how amazing your experiences are, how great of, how many community service hours you have, if they're not actually seeing it. So that's why we want to emphasize too, that it is important to do well in classes. It is important to, do well in your test scores and study hard, but those aren't things that define you. It's just something that's a necessary part of a health profession's path, is that you need to be able to handle the academic rigor of the school that you're going into. And so the way they filter out for that is by assessing your GPA and your test scores. So we recommend just during your first quarter at Cal Poly, just taking time to, like Julie said, like get adjusted to the quarter system. Things move very fast. Classes are more difficult than they are in high school. And there's just some more responsibility on yourself as a student to get your work done, because there really aren't any weekly homework assignments. Typically, it's more you get the material, you study on your own, and then you may have a couple midterms and a final that determines your grade. So it's a little bit more independent learning. So we encourage you just to build some strong and study and work habits early on.
So going off of that, Connor just talked about the importance of having a good GPA, but there's obviously more to the picture than just grades. So this is Patty Pre-Health, and this is a fun little tool that we have to just show all of the components of a really successful and well-rounded applicant. So starting from the top, this is kind of where we begin with Patty. So this would be like during your first year, like Connor was talking about the importance of starting a strong foundation and getting good grades. So oftentimes people start college and they think that they're interested in a pre-health career, and that's super awesome, but jumping into 15 different things might be overwhelming during this transition that is already a big change for everybody. So we always tell people to just focus on doing well in your classes and getting adjusted to that. And then as we move on into the ARM section, this is where you start doing your different experiences. So just talking about these 4 key experiences that make up a successful applicant. The first one we have is leadership experience. And this can really be in anything. Like you don't have to be a leader of the pre-health club. It's just showing any sort of leadership incentive throughout campus or in the community. And next we have health professions experience. So things like shadowing or doing hours in a clinic or something like that to show that you're actually interested in a career and that you know the positives and negatives to whichever career you're looking at. And the next 2 are community service and research. So community service, again, doesn't necessarily have to be in the healthcare industry. It's just showing that you have a passion for giving back to others, because that's what you're going to be doing pretty much for the rest of your life if you're committing yourself to a career in healthcare. And research is a big component of applications for especially medical schools, because you're showing that you are interested in the science aspect of medicine or whichever career, and being able to work with the professors closely and establish those relationships. And so moving down on Patty, the entrance exam. So this usually is taken during either the end of the third year or 4th year, depending on, every student has their own timeline and depending on their choices there. And so definitely just a lot of preparation for that. And obviously getting a good score on that sets you up for more success. And then other components of the application are the letters of reference and the personal statement. So letter of reference is going to be something from the experiences that you did above, probably. So like a professor you did research with, or a doctor you've shadowed and worked with, or something like that. And then the personal statement we talked about a little bit, but that's just kind of to show who you are as a person. Like you're more than just the numbers on your paper. So those are the last 2 parts, are the application process, like I just talked about, and then the interviews with whatever schools you're going to, so they can actually meet you and see the accumulation of all of these things.
Okay, so kind of going off on some of the things that Julie, Jacqueline, and Connor each talked about are this idea of competencies. So when we look at Patty, we're really talking about the what you need to do. Competencies are put out by the medical schools, but I use them to talk to all pre-health students, because competencies are something that all pre-health students should be working towards. This is just half of them. We'll go over the other half of them in a little bit. This half is more academically focused. So we've been talking a lot about academics and balancing academics with activities. But specifically within academics, it's not just the specific courses that you need to take. Yes, you need to take chemistry, and yes, you need to take biology, and you might need to take anatomy and physiology, or you might need to take organic chemistry, depending on the profession you're applying to. But really, it's not just about the content. That's really those science competencies, the living systems and human behavior piece. However, the thinking and reasoning competencies are kind of the how. How are you approaching your studies? How are you integrating chemistry and biology and psychology and physics? What do those subjects have to do with each other? That's your critical thinking. And so that's a really big part of your approach to school that is often underscored with a lot of pre-health students. There's so much emphasis because there's so much stuff that you need to do before you can apply to graduate school, that sometimes it's really easy to get lost in the weeds of that and forget the importance of these not as much talked about things, like the critical thinking is a big one. But then along with that, quantitative reasoning, which would be like understanding math and statistics and understanding how to interpret research, understanding what scientific inquiry is and asking questions, and then how do you communicate all of that information. So again, sometimes those things can be a little bit lost in the shuffle of, I need to take these specific set of courses with these specific set of units. And so the thinking in a competency mindset can help get you back into your why and your how of all of these pieces that you're doing. So then we're going to go on to some more myths, I think. There we go.
So this is a quick note. It kind of sums up a lot of things we've already talked about just on academic preparedness as you guys start your time at college. So yeah, as we've said, you want to focus on your grades first and give yourself at least a quarter to adjust. You'll have a lot of things to learn, even if it's just, learning how to do your laundry. That can honestly be a big stressor at first. And so just give yourself some patience and just focus on your grades, focus on your study habits. Can't emphasize that enough. One thing that's a little bit niche is that you have a couple GPAs coming out of your time at college. So your first GPA will be your overall GPA, and so that incorporates all of the classes that you take here. That'll be all of your GE classes, your major classes, and your support classes, and your elective classes. So this is a GPA that kind of reflects how you learn overall, your ability to learn different types of subject matter, and kind of your consistency throughout college. And then on the other hand, you're going to have your prerequisite and science GPA. So these are the classes that you're specifically required to take for that health professional school. So each school has a specific group of classes that you're going to need to take to apply there. So these classes you'll definitely want to take extra care with, because this is the material that when you get to that school, that's the material you're expected to know and be able to build upon. And so, yeah, as you're studying for them, you definitely don't want to treat it lightly, and you don't want to treat it as if, you're just going to forget it after you finish the class, because they are requiring those classes for a reason. As we said before, upward grade trends are important. So don't get too discouraged if things are difficult at first, but just work hard to improve your GPA if you're not happy with it. Kind of going back to those competencies, those are things that take time to learn, and schools recognize that. So just remember that. A really key thing towards the end here, it's really important to build your relationships with your instructors and faculty and be engaged in your learning. I think that it can be really easy. They really kind of easy to be passive about your learning, because you really get kind of pummeled with things sometimes during college. But one thing to just be really cognizant of is interact with your faculty. They're there to help you, and they're there to build relationships with you. And in the end, those are the people that will be giving you your letters of recommendation, and those are just really valuable relationships. And then one last point here about the MCAT. It's actually not just based on the hard sciences. So there's a section that is based on the social and behavioral sciences. So that's why we recommend that you take psychology and sociology classes as well. And we just want to kind of let you guys know that right off the bat, so that you don't treat those classes lightly, and just know that you might need to know that information in a few years.
And myth number 5 is that AP scores meet admission requirements. This is not always true, and it definitely varies a lot between different careers and different schools and programs. So it's something that you need to track carefully and work with the advisors on in order to figure out which AP tests you have that will be able to be counted towards graduate school, and which will only count towards, let's say, like your Cal Poly degree and classes. So even between schools, like sometimes they'll accept certain subjects and other ones they want to see you taking those at a college level institution. So you may need to repeat a course, like if you pass like AP Chem or AP Bio, like they may want to see that taken at an actual university. So sometimes you do have to retake classes, or other times you can take a more advanced class in the same subject. So just taking a higher level thing or a higher level class to show your competency in that subject area. So this can be kind of confusing. So just definitely meet with advisors during your first quarter to figure out your own plan and see how to best use your AP credit, and also figure out your academic plan for the next 4 years and what that will look like. But don't get discouraged if you took a bunch of AP classes and you were really looking forward to that credit, because even if you do end up having to retake that classes, those AP tests, one, helped you get into Cal Poly or other institutions, and also are great preparation for college level work. Like I had to retake a class myself, and I don't think I would have been that successful if I hadn't had background and just being able to form some of those study habits during AP classes. So they're definitely still helpful.
Yeah, and myth number 6 is that I have to do a medical service trip abroad, play an instrument, tutor, and do cancer research. And so this is a really easy trap to fall into as a pre-L student. It's something that I did for sure my first couple of years. At Cal Poly, you're surrounded by a lot of very impressive other students, like very hardworking and dedicated. And it's easy to look around and see like, oh, she went to Ghana for a service trip and he's doing leukemia research. And like, should I be doing that? Am I doing enough? And the important thing is just to kind of slow down and identify opportunities and experiences that are meaningful for you and things that you are genuinely passionate about. And this quote is something that Megan shares with all of her peer advisors, and it's something that I've come to really appreciate over the past few years. And it's, the older I get, the less impressed I've become with originality. These days, I'm far more moved by authenticity. If your work is authentic enough, believe me, it will feel original. And this is 100% true. So if you spend your time in undergrad doing things that you don't really enjoy, but you think that they look good on your application, that's going to show up when you go and interview with that school. So it's important that you pick things that you can talk about at length, and that when you talk about those things, it's evident how passionate you are about it and how much you enjoyed it. And it's important just to keep in mind that your best chance of getting into a health professional school is you just being your complete self, like not trying to be somebody else or somebody you look up to, just doing what feels right for you and what makes you happy. So.
All right, so kind of going off of what Connor was saying, and coming back to this idea of those competencies, it's also very easy to get stuck in the weeds of, I need to do these specific experiences, like Connor was saying. It's easy to get in that comparison mindset of, someone is doing this particular activity, I should be doing that too. And if I'm not, then I'm not going to be a strong candidate. And competencies are a way to help you get out of that comparison mindset and back into your own personal journey. Like I said at the beginning, this is a very individualized path. And while all of the paths do look very similar, they are all still very individualized to the applicant. So each of these competencies address different areas of basically how you interact with other people and how you show your care for other people. You know, it's called health care for a reason. And so, so schools really want to see and that you have shown your capacity for caring for other people through service and through your social skills and through intercultural understandings of and backgrounds of people, working together as a team, and how you communicate, your ethical decision making, and can you make sound decisions and rational decisions? How reliable and dependable are you? And resilient are you at overcoming challenges? And then capacity for improvement is really one that I think sums up all of these competencies so well. It's really your interest and desire to be a lifelong learner, and your ability to have that resilience and look at mistakes with introspection and growth, And if you haven't heard of the growth mindset, that's basically what capacity for improvement means, is having that growth mindset. So the growth mindset is basically, if you mess up or make a mistake, that you forgive yourself and notice areas that you can improve for next time. And so that is actually a really important piece for admissions committees. Like the peer advisors have said about grades, and if you have a rough start, that can really show some resilience. If you then take a turn and you start getting really strong grades, it can really show that capacity for improvement and that growth mindset. So I really think that that's one of the most important things, and will really support all of the other competency areas, the interpersonal, the science competencies, and the academic competencies. If you can find that as your foundation in this process, then all of the other competencies will develop a little bit more naturally, along with you will be more authentic and true to the experiences that you choose and the classes that you choose. And then ultimately what that means is you'll end up in the career that's the right fit for you. Because health professions advising isn't about getting any particular school, any particular applicant to a particular program and making sure that, that they get there. It's about making sure that they get somewhere that they fit with. And so a lot of what our emphasis is with students is making sure that you are making decisions that really fit with who you are. And those can change over time, and we'll talk a little bit about that in a second too.
Okay, now going back to some of the experiences that we talked about, especially with the Patty Pre-Health example, now we're just going to all speak about some of the things that we do just to show that there's such a diversity of ways to get these experiences, and there's no right way or wrong way to do it. It's just everyone has their own path, like we've been talking about. So speaking for myself, something health related that I've done is I've done some shadowing with different optometrists, because that's what I'm interested in. And I've tried to look at different settings or different types of practice just to see like where I can see myself and to really get to know their career, because I think that's something that's super important, is to recognize where their career is going, and also to see some of like maybe the less desirable parts of their career and show that you're still interested in it, even when you know the whole career as a whole. And in terms of community service, I do a lot of my community service through the honors program. So I guess the most recent thing that we did was this last quarter, we did it was called the Heart Project. And it was basically like we had people from all over campus come to our office and paint hearts to raise money for a local nonprofit that helps kids and families with young children that are affected by cancer. So that's just something I do, but there's a ton of organizations. You don't have to do it through one or another, just different clubs and programs that can help you get involved in the community.
Yeah, and for myself, to add a few examples, for health related, I took the shadowing class that the pre-health office offers. That was actually a pretty pivotal point for me when I decided I wanted to be a nurse. So I got to shadow a nurse for 21 hours. And I also volunteer at the local hospital, holding babies in the neonatal intensive care unit, and I get to watch nurses there, which is great. Let's see, in terms of leadership, being a peer pre-health advisor is an example of that. Leadership can look like a lot of different things though. You can kind of do it more on a big group aspect or one-on-one. So the peer advising is more of a mentorship type of leadership. And then research, I did a year of research with the chemistry and biochemistry department as well.
Yeah, and for me, so going off of leadership, this job, like Julie says, of being a pre-health peer advisor is that kind of mentorship role and working with first and second year students. And then I'm also a club officer with a public health organization on campus called Pulse. And we basically just do health and wellness outreach and promotion for the student body and faculty. And I mainly focus on diet and exercise with them. And then for community service, I volunteer with the local slow food bank in my free time.
And so again, we just want to emphasize that there's no right or wrong experience, and there's so many different opportunities at Cal Poly. Again, if you go to our website and click on the experiences menu bar, you'll be able to see some other examples of ways to get involved, both on campus and in the SLO community. And you'll also see some reflective questions that we really encourage students to spend some time thinking about, journaling about, discussing with friends, family members, advisors about their experiences, because that's really what helps solidify the impact and can further develop those competency areas.
So speaking of ways to get involved, here's a list that we have of the different pre-health clubs on campus. So basically there's a pre-health club for almost every profession, as well as some general ones like AMSA's just American Medical Student Association, or some for more specific interests like neuroscience or nutrition. So there's definitely a ton of ways to get involved at these clubs. They usually have weekly, bi-weekly, or monthly meetings where they'll introduce you to different opportunities or people in the profession, or just to get to know some like-minded students and students who are going through the same thing as you and in the same situations. So these are just the pre-health clubs. So there's also just a ton of clubs on campus in general for anything that you may be interested in. So tons of ways to get involved and to actually find some of those different experiences that we were just talking about.
So a quick note on health field exposure and why it is super, super important. This is a really critical time in your life where you're looking into a career that you want to do for many, many years. And so it's really important that you make a decision that's based on lots of reflection and knowing yourself and knowing what you're cut out for and interested in. And so, yeah, a key point is that you just do enough research and you get exposed enough so that you understand the profession that you're interested in fully. For me, I personally came in as pre-med to Cal Poly, and I didn't know too much about the career. I didn't really know how I fit into the health field at that point, and it wasn't until I started my own research and started shadowing and talking to people that I realized I thought that nursing was actually a much better fit for me. And that could be your story as well, or it could just solidify what you're already leaning towards, which is also extremely valuable. And that's the point that you want to eventually get to. So both shadowing and direct patient care is really valuable. Shadowing will give you a direct look into the day-to-day life of a certain profession, whereas direct patient care, you're going to start to build your own skills and see where your strengths and weaknesses are. And you'll also be working with lots of different people on the healthcare team and just kind of develop a more holistic understanding of healthcare, which is super, super important. And as Megan mentioned, I wish I could star this one really big. You really want to be able to explain the impact that all these experiences have on you. 4 years in college is a long time, and it's a long time to be trying different things. And so when it comes time to write your personal statement and interview for these schools, you want to be able to remember those moments very vividly of, oh yeah, I remember how I felt in that moment. I remember what I thought leaving the clinic that day and why I thought this could be what I do for the rest of my life. And so that's a resource that we have on our website with some helpful questions for how to reflect. And it's a skill that you'll kind of want to start right when you start getting your health field exposure.
And just one last myth that we're going to talk about is that becoming a physician is the only career option for me. And so every year at Cal Poly, we have hundreds of students that come in that are set on being pre-med, or they're going to be a neurosurgeon, they're going to be a pediatrician, they've known it since they were 5. And a lot of people do end up doing that, which is great, but there also are a lot of students who decide to change their path, either to a different career in healthcare or to something completely unrelated, and that's totally okay. It happens for a number of reasons. It's not always that somebody just doesn't do well in classes. A lot of the time, the career isn't what they expected, or it wasn't really in line with what they really enjoy. And so I would just encourage you all to be very open-minded when you come to Cal Poly. It's good to have an idea of what you'd like to go into. And as Julie just mentioned, doing research into those things and finding out if they are a right fit, but also just be open to things that you've never thought of. So for example, I came into Cal Poly as a civil engineering major with zero intent whatsoever going into healthcare, and realized later on that I really did enjoy civil engineering, and just through some experiences, I ended up switching to biomedical engineering. And at that point, I thought I was gonna be a physical therapist, and I found out that wasn't right for me either. And then now I'm in my 4th year. I changed majors the 2nd time, and I'm pre-med, and I'm very confident in that decision now. But it took a lot of trial and error, a lot of putting myself out there in uncomfortable situations, a lot of taking classes that were outside my comfort zone. But ultimately, it's those things that got me to where I am now, and I'm very grateful for those opportunities. And so don't be afraid, just to try new things and give them a chance as you take those classes. That being said, there's so many different careers in healthcare. Other than being a physician, you can be a nurse, you can be a PA, a perfusionist, a respiratory therapist. And this website, explorehealthcareers.org, is a great place to start that search. You can filter by like the years of school that you want to go to, like the quality of life, like how many hours do you want to work realistically? That's a big component of it too, is how is this going to affect your personal and family life later on? And the important thing is just finding the right fit for you, not the right fit for what your parents want you to do, or what your friends want you to do, or what you think sounds the best, or what makes the most money. It needs to be something that you genuinely enjoy and are excited to go into work every day for.
Okay, so thank you to the peer advisors for addressing all of those myths. I'm going to talk a little bit about our medical school acceptances. I've noticed in the Q&A that that's a popular question, and it usually is every year. This is for the past 5 years, or I guess not the past 5 years, because 2019 data is not included in this yet. But for the past 5 years, this is where our students have gone on to allopathic medical schools. The first column at the top in bold, those are the California schools. They are widely represented. California also has 2 new medical schools starting that we will likely have students heading that way this cycle or in the next couple cycles when those schools officially open. But you'll also notice that students go nationwide for medical school, and that's not uncommon. That's not uncommon, not just with Cal Poly, but with all undergraduate institutions. Being willing to go to medical school is really just what you kind of need to have as your foundation, not being committed to a particular medical school because it can be so competitive. But what I will say is, from all of our students who apply, when they do find out where they end up going, it may have been a school that they weren't strongly considering, but after they interviewed, they became really excited about it, and it ended up being the right fit for them. It's pretty rare when we have a student say that they don't feel like their acceptances are, that they fit with them and that they don't want to pursue them. So students end up where they're supposed to be is the long and the short of that. We also have students apply to osteopathic medical school every year. And osteopathic medicine is essentially, I'm not going to get into the real nitty-gritty details of it, but osteopathic physicians are essentially just another philosophy of medicine. Their basic tenets are that mind, body, and spirit are interconnected, and that the body has an innate ability to heal itself, and that that the physician's role is to support the body in its self-healing. Because of that, sometimes it gets a reputation of being alternative medicine, and it is not alternative medicine. It is still Western-based biomedicine. It just has some of these other philosophies that it brings with it. And what I will say actually is that allopathic medicine actually incorporates a lot of those philosophies as well. It doesn't get the title of it. These schools for the osteopathic, on the osteopathic list, might not be schools that you are as familiar with. And that is because osteopathic schools are not usually at largely undergraduate institutions like many allopathic medical schools are. So it's not that these schools are one-offs and not accredited, it's just that you usually don't see them when you are in high school applying to undergraduate programs, when the undergraduate schools' names become more familiar to you. So these schools are all accredited, and again, they are nationwide. Going back to the idea of that philosophy of allopathic and osteopathic medicine, what I will say is that osteopathic medicine and allopathic medicine are equally as competitive to to apply to and be accepted to, and I'll go over the statistics of med school admissions in just a second. But also going back to what Connor was saying about the importance of exploring and not feeling tied to any particular profession. And what Julie was saying about the importance of getting experience in shadowing. It's pretty common that most incoming first-year students have no idea that osteopathic medicine and this philosophy even exists. And that's just an opportunity to really learn more about the profession that you're wanting to go into. And that's what you want to be using your time before you are ready to apply to do, is to learn about the professions that you want to go into, and learning the different philosophies and backgrounds and histories of the professions that you're interested in is an important piece. So here's some of the data of Cal Poly students graduating and going on to medical school. This is aggregate for both allopathic and osteopathic medical schools. And one thing that I will say is very common, and I'd say that this is common nationwide, is that more often than not, students are taking time off in between undergraduate and graduate school. So you'll see the number of years since graduating. Over 60% of students are taking 1 to 2 years off in between graduating from Cal Poly and starting medical school. And the reason is not necessarily because they weren't doing well. More often than not, it's because they're doing really well and they have so much more that they're excited about that they want to do before they go on to medical school and make that commitment. And so it's not uncommon, and it doesn't mean that you're off track by not going right directly into medical school. You'll see that actually going straight into medical school after you finish at Cal Poly is the least common of the years since graduating. So it is a pretty small number of students who go straight into medical school after graduating. As far as majors go, the most common major is biology, but like we said earlier in the presentation, biology is by no means a requirement to go on to medical school. The reason it's a popular major is because it's a life science, and medicine is a life science. And so there's some commonality with that. At the same time though, biology is more than just medicine. And so as a biology major, you want to be prepared to be studying ecology and evolution and the diversity and history of life and cells on the planet. And so it's important to remember that your choice of major, like the peer advisors had said, is more than just your profession. And so you can be any major. Students from Cal Poly choose a variety of majors for health professions. One major that's not on here is our public health major. That's because it's a new major, and this data was all before our public health major started. And so we will likely see a large number of students from the public health major going on to medical school as well. As far as GPA and MCAT scores, you'll notice, like again, what the peer advisors have been saying about an upward trend, and having a stellar GPA isn't the only piece of it. While yes, the average GPAs are in that 3.6 range for both your science and your cumulative GPA, you'll notice that the range starts at a 3.0, 3.1. The MCAT, the median MCAT score nationwide is a 500. And so Cal Poly's accepted students are right at that and above. I can't actually remember what the MCAT total is out of. I think it's 520 something. So our students score pretty high. They also score average, and some score on the lower end, but just to show that you really do want to make sure that you're getting above the national mean in order to be considered to medical schools. The BBFL is the life science section. It's the biological and biochemical foundations of living systems. And so the median score for that is a 125. And so typically our students, our accepted students, are scoring at average 128, but the range is 122 to 132. Sorry, I didn't update the PowerPoint on the years. This is from 2014 to 2017. The 5-year acceptance rate was 46%. So that means that 46% of students who applied from Cal Poly were accepted to medical school. one caveat to this number that I really want to emphasize is that this should not be a reason that you choose or not choose any institution. The data that all undergraduate schools get from the medical schools on where their students go is not comprehensive. It's based on students electing to offer us that information on their application. And so it's not comprehensive. It's also raw data, and different schools will have different ways of calculating that number. And so it's important to just take that information with a grain of salt. And then most importantly with this number is it's not this isn't playing the lottery. There's no chance in applying to medical school. It is 100% all about you and the responsibility that you choose to take in this journey. And you, no matter where you go, you have the opportunity to increase that percentage no matter what school you end up at. So it's not actually where you go to school that determines where you go to college that determines where you go to medical school. It's really all about what you do with yourself wherever you are. And so that's why we put so much emphasis on finding not just the right fit of a graduate school, but the right fit of an undergraduate school as well. Somewhere where you will be successful. So I'm going to have the peer advisor share a little bit about why they like Cal Poly.
All right, so for me, I remember what really drew me to come to Cal Poly was the fact that we do have pretty small class sizes. I really didn't find it desirable to be in a class with 500 other students. Like, that's just not really something I was looking for. And I also liked the idea of having my classes be taught by professors with PhDs and being able to be part of this learn by doing philosophy. And now I'm in the end of my third year right now, and I can say that this all holds true and honestly went beyond my expectations. The professors that I've had have just been also willing to help and also just open to creating relationships and really invested in our learning. Like my first year, I was able to go to office hours for some of my professors, and they actually knew my name, and just being part of that and being able to be in that relationship with professors was really helpful for me to doing well in classes. I don't think I would be able to thrive in a situation where I'm just another name on the roster in this huge class. So that's been really amazing, and I've had a great experience with all the faculty. And on top of that, the learn by doing philosophy honestly is really great as a student. I mean, my first class I was in, or my first quarter, I was in like 2 different labs, and really being able to do the learning myself. I'm not the kind of person that does well just reading a textbook or just watching videos or going to lectures. So being able to see what I'm doing and how it applies to something bigger was super helpful. And then my last comment on this is there's the note on the PowerPoint about less competitive atmosphere, yet talented individuals. And this is so true. Like all of my classes, I have study groups and people want to help each other. And that's something that's really awesome as a student, because sometimes people are just trying to get a leg up and have the best grade in the class, so they're not going to help you. And honestly, I feel like there's just such a community at Cal Poly, which has been really helpful.
Yeah, and building off of that, I have a lot of similar things to say as Jacqueline. I think that when I came to visit Cal Poly as a high school student, and I think that it just continued to kind of expand as I went through my years here. I think that especially with the faculty, I think that when they hire the faculty, they really hit home this point, and so you get these professors that are really behind this mission. And so in your classes and in your extracurriculars, all of your mentors are just really dedicated to the learning process. I think in my research experience, because we don't have a big graduate program at Cal Poly, it's very focused on the undergraduates. And in my research lab, we made a lot of mistakes. And I think that it was really refreshing to know that it wasn't just about like turning out the publications and getting the results. The professors and my research advisors really wanted us to learn how to be scientists and learn how to critically think, and they made it clear that it's okay if we made mistakes, but it really was about the learn by doing process. And I think I've just seen that lived out in all of my opportunities at Cal Poly, which I think is unique.
Yeah, and I have a lot of similar comments to Julie and Jacqueline. Like the small class sizes for me has been a huge help. Like for example, my organic chemistry labs had never been bigger than 12 to 16 students, which I think is pretty unheard of at a lot of universities. And having that one-on-one accessibility with professors for a difficult subject like that is incredibly helpful. And you also get to know the faculty on a much more personal level. Like a professor of mine, like I hike with on weekends occasionally, like you just become friends with them. And, you know, it's pretty amazing that you're able to do that and just get to know them as a person and not just as your professor. And then also the learn by doing thing, I know it's probably been hammered into you by now, and we'll keep talking about it during WOW and slow days if you choose to come to Cal Poly, but it's very true. Just having the opportunity to do the things that you want to do in your career while you're here at Cal Poly is incredibly valuable. Like for example, I'm very passionate about public health and general health promotion, and so being able to be a part of Pulse where I'm able to help organize a wellness campaign and find out what are the issues that you run into, what are the problems that you face, and kind of hitting those roadblocks and dealing with them. You can't really get that same experience or learn the same things by sitting in a lecture hall. And the last thing I would say is just the fact that you're getting a UC quality education or better for a state school cost. Finances are part of picking a college, and I think it's been super helpful just to have the cheaper tuition. And I was debating between Cal Poly and a few UCs, and I definitely don't regret my decision at all.
We are at after 5 o'clock, and so if you need to leave, you are welcome to. We are going to finish the presentation. We just have one last slide, and again, it is being recorded, and so if you want to come back and finish, if you need to leave and want to come back and finish watching it later, we will be posting it to our pre-health professions website. So thank you all for coming if you have to leave, but we'll keep going. So.
Okay, so yeah, we just want to leave you guys with a couple of things to think about for tips on selecting university. You might have already committed to Cal Poly, but also there's probably a good group of you who are still deciding, and it is a really big decision, and so we don't want to pressure you guys either way. We just want to make sure you reflect on the right questions when you're choosing which college you come to. So the number one thing on this list, or I phrased that poorly, it's not the number one thing to consider, but it's the first thing on the list, is to consider the finances. It shouldn't make up your whole decision, but it is important because especially those who are considering to go into a health professional school, those schools also cost a lot of money. And so you want to start thinking in those terms and, you know, and with the least amount of borrowed money for the education that you get out of it. But there's also a lot of other things to consider that are really specific to the school and really what best suits you. So you want to look at the motto of the school. You want to look at the opportunities that are there in terms of clubs and research opportunities and internships. And yeah, we touched on a lot of those things in this presentation. And if there's something that kind of hit home for you and you thought maybe I'd be interested in doing that, that's a really good sign because you want to come to a school where you want to get involved, you want to build a community, and you want to stand kind of behind what the school stands behind too. And one note on the academic rigor as well. So, you know, after high school, you probably have a good idea of your learning style and yeah, kind of how you study. And so you want to make sure that the science curriculum is both rigorous, but also one that you can successfully complete. So you want to make sure that, you know, the classes that you're attending, you are learning and you're growing in those classes and you're getting well prepared. But of course, as we've said before, you also do have to be successful to end up at a school that you're interested in going to for a pre-health profession. And so just consider that in your choice. One big note at the end here is don't choose an Ivy League school just because it's an Ivy League school, or insert whatever school name you want to there. I think that this was a big part in my decision process as well, and it's really important to look past that name. whatever is drawing you to a school, you want to make sure it's for the right reasons. And so do your research and consider all the things that I just said. And Megan touched on this earlier, but don't make the school statistics on students accepted into health schools a major part of your decision. You do want to make sure that the school you attend is able to provide the opportunities for you to become a competitive applicant. But again, it is, there's no, like Megan said, there's no chance in you getting into a health professional school. It's what you make of your experience in college and what you do as an individual to build that application and develop into a good applicant. So yeah, just think about those things. We hope that you consider Cal Poly, but of course, just make the decision that is best for you.
All right, so that is everything that we have to present to you all today. Thank you again so much for coming. You are welcome to stick around and continue to type in questions into the Q&A. We'll stick around for another couple minutes and answer some of those. On the slide here, you'll see that you have access to our peer advisors. They will be available for drop-in advising virtually over the next few weeks, and so you are welcome to drop in with them. Also, you can explore around on our website, email the peer advisors, or there's also that Explore Health Careers website to check out. We have one question that came in that I will just answer about the hands-on anatomy labs. We do have anatomy labs at Cal Poly that are hands-on. They are cadaver labs, and so students do get to see the human body close up in their anatomy labs at Cal Poly. Some other questions that were common and popular were if biology majors have priority for the advanced bio classes, and it's not that they have priority, it's more just that there are courses that are courses have a lot of prerequisites for them, and so if you're not a bio major, it can sometimes be a long process to be able to get into those classes or take those classes. But there are opportunities for lower division courses that are similar. So we have advanced anatomy and physiology that mostly is just bio majors who take, but then we have other anatomy and physiology classes. Both sets of classes use the cadavers, and students from other majors will take those lower division anatomy and physiology courses. Another common question, it looked like, was about just the acceptance data that I went over with the how long students take to go on in between undergrad at Cal Poly and graduate school. Another common question was if there is any MCAT support or other type of support for exams, and yes, there is support in terms of advising, but we don't necessarily have any specific prep course that is taught at Cal Poly for students. But we will support you in finding the right kind of support for your entrance exam that you need to take. There was also a lot of questions about our shadowing course. That is basically you are matched with a provider of your first or second choice usually. It can be a physician, or it might be a nurse, or it might be a physician assistant. And then within different specialties of medicine, it kind of just depends on what types of physicians are willing to host students in that particular term. So it can vary a little bit here and there. Some other questions that have come in. For transfer students, this is a great question. How long or how difficult is it to complete prerequisites within 2 years? It really depends on what your major is, how many of your major and GE courses you've completed at the community college before transferring, and how many prerequisites you have completed. So it's a really individualized piece, and so I would definitely recommend, once you come to Cal Poly, meeting with an advisor and we can map that out for you. Most students, I will say in general, most transfer students coming to Cal Poly are able to graduate in 2 to 3 years. It's pretty rare, I would say, that many transfer students need a full 3, but some might need like 2 years and a quarter or something like that. The pre-health learning community has not always been in Yaqui Tutu. The question was if it's always located in the Yaqui Tutu Residence Hall, and it has not always been there, but it has been since the Yaqui Tutu Residence Hall opened. So we like being there because it's, you know, the new one, and so hopefully it will stay there, but we don't know for sure because we haven't heard yet from housing, and we don't know what's happening in fall yet. So so we won't be able to answer that specifically yet, but we will know more over the summer. About the, let's see, I think I saw a question about the nutrition major, but I think somebody already answered that. So I think we have addressed all of your questions. Like I said, we'll stick around for another minute if you are continuing to type in some questions. And thank you all so much for coming. All right, let's go ahead and wrap this up. Thank you so much, everyone, for coming. Oh, I noticed another question from transfer students. How will registering for classes work if slow days is pushed back? So slow days is happening in late August. I don't remember the exact date. We were just talking about this today. And so I don't know exactly when the specific registration date is because it did just change to happen during the summer for everyone. But we will support you in registering for classes in whatever capacity that ends up being in. So you will learn more about what was going to happen with slow days as we get more information from the university, as the university makes decisions about fall quarter. As far as how many pre-meds we have at Cal Poly that we're advising, it varies a lot because students change their minds a lot. And so it's hard to really put a specific number on it. I would say that students who are first year students, we'd probably have about 100 to 300 in any given year. And then students who actually apply to medical school each year, so in their third and fourth year and alum, there's usually about 50 to 60 students who end up applying each year that we know of. Like I said, we don't get the data from every single student. So that's about how many students, and usually those students drop off from being interested in medical school, not just because they're not doing well, it's more often because they found other interests that they're more passionate about. So yeah, I think we have addressed all the questions. Again, thank you so much for coming, and this is being recorded, and so if you want to come back and reference any of it, we will be posting it on our website. We'll also be posting screenshots of the slides on our website as well. So thank you again all for coming. If you have questions, feel free to email the peer advisors at prehealth@calpoly.edu, or feel free to drop in with them at any point on their drop-in hours, which are listed on our website. Thank you all so much.